Hi, my name is Connie Kleiner, so you're watching the video on the Bagolini Striated glasses test. This is a test, as is a worse for lights test, a test that can look at retinal correspondence and sensory adaptation. So it's able to give us information around simultaneous perception, sensory fusion, and on adaptations such as suppression and ARC. So what are Bagolini glasses? They are in essence a pair of glasses, and they can be in either trial lens sets, which we can see here, or they can be in a lorgnette, which we can see here. And the lenses are a pair of plano glass marked with fine parallel striations, and you can just see these pair here, that there is a fine striations just there. And these striations are placed at a particular orientation. And so for one glass it's at 45 degrees, and for the other glass it is at 135 degrees. So where we have a lorgnette such as this, the Bagolini glasses are placed in the orientation required, 45 and 135. When you have a lens set, then you will be required to place these in the right orientation, which is again 45 and 135. Okay, why is this orientation important? Well, when you shine a light in front of the patient and they're looking through Bagolini glasses, what it will produce is the patient will be able to see a light source and a line running through that light source. And that line that they see will be perpendicular to the striations of the Bagolini glasses. So let's have a look here. In this scenario, let's assume that the orientation of the Bagolini glasses are as we see here. So the right eye is looking through this eye, the right eye is looking through this lens, and the left eye is looking through this lens. And so what we expect is that the line seen by the right eye will be, as I said, perpendicular to the striations. So the patient will see a light source and will see a line running through that, and for the left eye it will be again in the opposite direction, and they'll see that single light source. So a patient who has BSV will see a cross, as we see here. They will see one light because they will fuse that one light, so one being seen from the right eye and one being seen from the left eye. And the lines, because they're in different orientations, they will both be seen. So one is coming from one eye, and we can see this one here is coming from the left eye, as it's the same as that one there, and this one here is coming from the right eye, as it's the same as this one. So in having a BSV response, again, as we talked about with worse for lights, this could either be NRC or ARC. We need the cover test result and complete investigation to determine whether that BSV response correlates to ARC or NRC. There is one other possibility with Bagolini Striated glasses, and that is that a patient may have a BSV response such as this, where the patient indicates that there is a cross, but there is a missing component to that cross, and we can see here a missing part. This indicates central suppression, so BSV will be central suppression. And we can tell which eye has a central suppression because we look at the line that this line belongs to, and we know that that's the left eye here. So we have left central suppression here. Given that we have these scenarios where a patient could have either a complete cross or a cross with one of the lines having a missing part, it's important that when a patient does indicate that they see one line and a cross, that you then ask whether one of the lines has any missing parts to it. Patients are unlikely to volunteer this, so you need to ask that question of your patients to actually hunt for central suppression. I found that the younger the individual is, generally young children, even if there is central suppression, it's very difficult for them to look for it or articulate or understand the question that you're asking of them. But the older the child, and certainly adults, are able to look more acutely at what they're seeing and able to identify if there is central suppression. Now, if a patient has diplopia, they will see two lights. And these are the sorts of responses, C, D, E and F, are examples of diplopia. So when we shine the light in front of the patient, one of the questions, or the first questions that we'll ask, is how many lights do you see? And one light indicates that they've either got BSV or suppression, which we'll talk about in just a moment, and 2 lights is clearly indicating that you've got diplopia. Now, as with Westphal lights, with Baggalini striated glasses, we can determine if we have crossed or uncrossed diplopia. To do this, we need to work out whether the light has crossed over to the other side. So if we take the example here of C, this again belongs to the left eye, and this line here belongs to the right eye. And the light here, the light source that belongs to the left eye, has crossed over to the right side. So we actually have crossed diplopia, whereas on this side here, the left has remained on the left side, and therefore we have uncrossed. In E, we have height. So what we see here is that the right light is above the left line, which indicates that we have a left on right. And here, I just wanted to show you that you can also have the lines quite separated from one another, which all it means is that the deviation is greater, so they don't actually end up crossing over one another. So in this instance, again, you just have a look that's left remaining on left side, right remaining on right side. So we have uncrossed diplopia there. And finally, we have suppression, where the patient can see the light and one line, and we can work out from here that it is the right line that's missing, so we have right suppression. And in the other instance, just here, we've got the right line, so the left eye is suppressed. Now, this can be performed at 6 metres and 1/3 of a metre. At 1/3 of a metre, you just use a pen torch. At 6 metres, often what you'll find is beneath the vision chart, there will be a single light source you can use for Baggalini striated glasses. And we do this in natural settings, so we do it with the lights on, and we perform this in natural settings where we leave the lights on in clinic. With the Westphal lights that we talked about earlier, we perform that in the dark. So there is a difference between the Bagolini striated glasses and the Westphal lights in the conditions by which you perform the test. So Westphal lights is more dissociative because you've got red-green goggles on and you're doing or performing the test in the dark, whilst Bagolini striated glasses, the glasses are clear and you're performing it in natural room lighting. So those differences can actually result in different responses from your patients between tests. So as an example, there are instances where patients may provide a BSV response with the Bagolini striated glasses under more natural settings, versus when you put them on, or the same patient on the Westphal lights, the dissociation leads to suppression or diplopia. So bear that in mind, that when you're performing these tests, you may be selective in which test you use, or you may want to perform both to see if the response is different under different testing conditions. In terms of a recording, we would indicate that we've performed the Bagolini striated glasses, what distance you've performed it at, and generally often we'll actually draw what the patient saw, with again an interpretation. So here we've got BSV for the process soon. In this instance, we've got uncrossed diplopia. In the final instance here, we've done it near and we've got right suppression. Again, just be mindful that in order for you to make the correct interpretation, you will need to be very, very mindful about how you presented the striations to the patient. So how were the Bagolini glasses oriented in front of the patient's eyes? Okay, that brings us to the conclusion of this video. Thank you for watching.